Hi guys, I'm Dr. Priyankamehta, obstetrician, gynecologist, laparoscopic surgeon. I welcome you again to this channel on health and wellness for all, especially for women. So I keep getting so many questions on an everyday basis about hormones, and we also have to talk about hormonal imbalance because there has been a lifestyle change over the past so many years, which is creating so much of havoc in women's life. In fact, hormones are something which are so essential. They're basically chemical messengers, and in this video I am going to be discussing what are the female hormones, what are the hormones all of us have, how they act, what happens when these hormones are not functioning in a normal way, and how do you correct them. So what are the hormones? So as I told you, hormones basically are chemical messengers, and these hormones are basically released from a small gland in our brains. It's a small little tissue which is called the pituitary and the hypothalamus, and these will release these chemical messengers which go around in the blood, and then they act on either your ovary, the pancreas, the thyroid gland, and the difference in this whole system is called the endocrine system, and that is what takes care of the different hormones, and that is what is important for a lot of functions that we do in our day-to-day life. Now women have some special hormones, and these hormones are the sex hormones, also called as estrogen, progesterone, and also a little bit of testosterone. So yes, don't be surprised, women also have testosterone, such as males also have the estrogen or the female hormone, because these are the sex hormones and these are made in our body from cholesterol. So whatever cholesterol or fatty food we are eating, that is important to make all these female hormones or even the male hormones in the men. So that is why what you eat and your environment and all the different kind of exposures that you have in terms of certain endocrine disruptors or hormone disruptors, which are increasing nowadays, and we will be discussing them in another video. And these hormone or endocrine disruptors actually can create a lot of problem in our body because of the hormone imbalance. So to make things simple, in this video I thought let me just tell you about how the periods happen and how the menstruation happens. So if you look at the menstrual cycle, if you look at the top part, so this is how the brain is going to release certain hormones called as the LH, FSH. So the first half, the FSH is one hormone, second half of the cycle is the LH hormone. A regular menstrual cycle or a regular menstrual period could vary between 24 to 34 days. On an average, it is around 28 days. And now if you look at it, as the initially the estrogen hormone will increase and then the progesterone hormone will increase, and that is what causes the menstrual cycle. But due to certain hormonal problems, or because of lack of exercise, or because of lack of proper diet, you may have an increase in the estrogen hormone and there is a reduction of the progesterone hormone, and this can cause an imbalance, and that is when you start getting irregular periods. Not only that, this is the root cause of the problem called PCOS, and the solution for this is also simple. That is why, because the way the hormones have got disrupted or they have become imbalanced, we have to try to bring them back to balance. So how do we know that there is a hormone imbalance? Usually women who have hormone imbalance can present with a variety of symptoms, like they could have problem with their periods become irregular, or periods become very infrequent, like they may not get periods for 2 to 3 months, and sometimes the bleeding can become very heavy, sometimes they can have very irregular bleeding in between the periods. Also they may gain weight, they can develop acne, that means a lot of pimples on their face, have very oily skin, they can have hair loss, they can have hair all over the face and different parts of the body. So this all sometimes presents as what is called as a polycystic ovarian syndrome, or sometimes there will just be some amount of hormone imbalance. Even some women develop a lot of breast pain, irritability, anger, which is called as a premenstrual syndrome also. So the basic point is that hormone imbalance, when it happens, we have to do certain blood tests, and with that we're able to find out to some extent that there is a hormone imbalance. And we have to do certain things. Like there are 5 things which I will tell you which can help restore your hormonal imbalance. So the first and foremost thing is that exercise. Try to find out time, at least 30 to 40 minutes every day, for some kind of brisk aerobic exercise. It could be yoga, it could be Zumba, it could be a brisk walk where you're just focusing on the exercise, or it could be a supervised strength training. Stress again is something which, just as it keeps accumulating, causes a lot of hormone imbalance, because as you get stressed, the cortisol hormone in our body increases, and this hormone is the precursor for the female hormone. So then the hormones also are going to get imbalanced. Lack of sleep. When you have lack of sleep, then again, say if you're awake till midnight or past midnight every day, that's a time when your body is going to produce a lot of cortisol. So you will not get any break from the cortisol in the body, and this stress again, lack of sleep and stress again is going to make sure that your entire rhythm gets upset, and that is going to be causing a lot of hormonal problems. A lot of chemicals in our food, a lot of chemicals in the products that we use. It could be cosmetics, it could be the kind of soaps you're using, or it could be the cleaning products that you're using. So all of these chemical products which are having different kind of chemicals, if you look at the labels, you will understand that it's full of lot of chemicals, especially different kind of body washes also, because skin is the biggest organ. So when you're using different chemical filled shampoos or body washes or soaps, these are again going to get inside your body, and these are called the endocrine disruptors, because these chemicals, like you would have heard of parabens or BPA, and all of these kind of chemicals basically enter the skin and they enter inside the body, and they will take the place of the natural hormones, and these are the endocrine disruptors. Because then, say for example, they are going to be affecting the organ, say the uterus or the ovary, so the normal hormone is not going to be able to act, and there are going to be side effects. Again, caffeine. So if your caffeine intake is very high, say you take lots of cups of very strong caffeine, or take a big mug of caffeine maybe 2 or 3 times in a day, and that again is going to increase your cortisol level. It is going to make you more anxious, it is going to produce sort of anxiety, and going to produce sort of hormone imbalance. So you have to make sure that you are either taking decaffeinated coffee, or you bring down the quantity slowly, or replace it with different kind of probably herbal teas or some fresh fruit juices. And adding to that also is the cookware. So if you are using cookware which is either non-stick cookware, or you're using aluminium, so these again have a lot of chemicals inside this, and this will go into your food. So this endocrine disruptor, again, all these chemicals can wreak havoc into your hormonal system. So try to replace plastics, like if you're heating food in the plastic, or if you're storing food in plastics or foils, or cooking in the non-stick cookware. So these again is going to be creating problem for your health. So try to replace these plastics as well as the non-stick ware with either iron vessels, with glass, with stainless steel, because that is more healthy for you. So we'll be coming back with more videos talking more about endocrine disruptors, but the bottom line is that health is something which is in your hands, and if you want to just remember, you should remember that eat well, eat more of good fat. So do not always think that fat is bad. Sometimes certain kind of essential fatty acids are in fact good, because fat only gives cholesterol, and that is the precursor, or all the hormones that especially the female hormones, the estrogen, progesterone, the testosterone hormone is produced by the cholesterol. So we need good fats also in our diet. Good fats can come from almonds, from walnuts, coconut, you have these chia seeds, hemp seeds, and all these different kind of seeds which you can add into your diet. So do take care, take a step back, look at your entire lifestyle, your diet, what you're eating, where you're buying your food from, what you're cooking your food into, how you're washing your food, what are the chemicals that are there in your house, and try to if not bring them to zero, try to at least minimize the use of the chemicals so that your hormones stay happy. Thank you and take care.